If you look at the left and the right, you see a difference. You can see the patient somewhat dissociated with arms and legs folded, suggesting a little bit of non-acceptance or self-comfort when the doctor is not engaging with her. The doctor is looking at the chart. His left hand is out, almost being dismissive, and the eye contact is avoided. But if you look at it on the right side, there's good face-to-face contact. There's pensive thinking with the finger on the cheek, on the chin, and the patient is much more interested in using expressive gestures with her hands, with an open posture. There was an interesting study that talked about the value of making a diagnosis. These were studies of doctors who were giving letters to patients about what they had. And they defined two types of letters, one that gave clear information, as you could see on the left, and the other more qualified information. And they looked at patients who had organic or structural diagnoses and those who had functional or DGBIs. And what we find is the doctors made more qualified definitions or diagnoses than the clear. Why? Because there was no finding, and they didn't understand the Rome criteria, and they didn't understand that you can have 98% confidence in the diagnosis by using Rome criteria in simple screening questions. So the patient got qualified information, and when asked afterwards what their diagnosis was, they would say, well, the doctor didn't tell me, because it doesn't register when they say you may have a functional problem, we'll see, as opposed to you have IBS. Whereas the clear diagnosis came because of structural findings. And so the patients with the functional or DGBI had more colonoscopies and procedures that were unneeded, simply to try to rule out other diseases.